Hi guys, my name is Megan Lemelin, and today I'm going to be presenting on my project, which is titled the Community Care Council. So the Community Care Council is going to be designed with a lot of research about food insecurity. So as we know, food insecurity affects a huge portion of the world, even more so in low-income districts. And for my project, it's really important to note that this was created for where I teach. So it is a low-income district. There's a lot of families that suffer from food insecurity. And it's my hope that this community care council that we're creating is going to create a lot of solutions for these families. So some key questions I worked with in my project. What can we do within schools to fight food insecurity within the community? And how can we get students to spark change in their community? So these two questions really were a guiding force in my research and how I kind of pushed through a lot of this information. So to start off, what is food insecurity? So a lot of people aren't really sure, but food insecurity, by definition, is the inability to attain enough food for an active and healthy lifestyle due to the lack of financial, social, or other resources. So food insecurity isn't always just that families don't have enough food, but rather that they don't have enough nutritional food. So food insecurity does affect more than 1 in 5 children in the United States, and these children who are affected will face physical, mental, and emotional effects. So for my literature review, I had some really great sources. So to start off, I categorized it into 3 different areas. The first one being the causes. So the 2 main causes that I found for food insecurity were housing instability and annual income. So the Community Care Council that I will be creating doesn't necessarily set out to solve these 2 problems, but it does aim to ease the challenge that they have. It helps them to shift their focus. So if they are not worried about finding their next meal, they can focus financially on housing or annual income. Next, I focused on the physical effects being physical, mental, emotional. For the physical effects, you have things like cardiovascular challenges or overweight, underweight, and as well as eating disorders. The mental effects of food insecurity are depression, anxiety, as well as the emotional being feelings of sadness or feelings of hopelessness. And there was a lot of research I found that showed that these feelings of sadness or hopelessness can often lead to suicidal thoughts or, in some cases, suicide. And lastly, for my literature review, I focused on some solutions. Now, these solutions weren't perfect fixes. They didn't completely solve the problem, but they did ease the challenge for a lot of the families. So the first one is the SNAP program. A lot of people have heard of food stamps, things of that nature. So the SNAP program is the Supplemental Nutrition Assistance Program. This is given to families who are well under the poverty line. And depending on how many people or children are within the household, you get a certain amount of money that you can use towards groceries. There's a lot of research done on the SNAP program that shows that it does help families a lot. And oftentimes, I want to say it's about 45% of families who are in the SNAP program have actually come out of the percentage of being in the food insecure homes. The WIC program, again, is a supplemental nutrition assistance program for women's, infants, and children. To qualify, the women must be either pregnant, breastfeeding, or postpartum. The WIC program has a lot of success, but is a little bit less used only because it limits the types of items you can buy. So there's less items that are available and eligible in this program. And it also limits the stores that you could shop at. So for families that do struggle with transportation, they actually have less stores that you can go to, so it might be a little more challenging to get there. And the last one is the National School Lunch Program. A lot of schools have free and reduced lunches. That's where this program comes in. So families who might not have nutritional food at home to send with their kids to school, they can apply and be eligible to receive a free or reduced lunch. So my literature review, all of the sources really helped me to dive into these, which helped create my program, which is the Community Care Council. So this program would be prevalent in the school and the community. Our hope is that we can help students, but also help their families as well. So to start off, Epstein had a really great section about an action team, learning how to create it, and what each person would do in the action team. So after reading through that, I created mine with myself, 2 teachers from middle school and high school, an administrator who would kind of oversee and approve events as they were created, 2 parents that would kind of liaison between the school and community. These would be the people who would push out information to the community. 2 staff members from the guidance office, nurse's office, custodial staff, cafeterial staff. These people would help with our backpack program that we create later on. 3 community representatives. Hopefully they would be either managers of restaurants or owners of grocery stores, convenience stores, things like that in town. And then lastly would be student advocates who would work in this program. So the Community Care Council is going to be implementing 4 different main programs within the school, as well as overseeing some curriculum that would be rolled out. So as far as programs, our first one would be composting. So composts are really wonderful. They have a lot of benefits. First off is the opportunity for learning. So in classrooms, students would be able to learn about decomposition, fungi, microorganisms, bacteria. They'd also be given chances for critical thinking. So the students would actually be brainstorming and working in teams to talk about how to start a compost. And later on, they actually would create one for the school district. So once the compost is created, some other benefits would be the reduction in food waste in landfills. The fertilizer that's created by the compost would be used for our community garden later on. And also this would give students a lot of skills that they can use later on in life when they have their own home someday. Next created is the community garden. So this garden, again, will have an opportunity for learning. So students will be the main helpers in creating this. They would plant all the seeds, they would plan, maintain the garden, everything. So for science class, they could learn about plant growth, the flow of energy and photosynthesis, things like that. And it would give them a lot of opportunity for critical thinking. So they would work together to plan the garden and map out where they're going to put the seeds. They have to work together to make sure they're watering it correctly. They have to make sure the soil quality is okay. There's also a lot of unforeseen challenges that might arise, like bugs or soil quality not working and plants dying. So they'll really have to work together to make sure that the garden is a success. Once the garden is running and is producing vegetables, fruits, and herbs for the community, this food will be shared with them. So community members would be able to come and harvest these, or they would be placed in our community pantry that I will talk about soon, and community members would have access to these as well. So some other benefits are physical exercise, being able to walk around and do some weeding and watering, things like that, and also mental health. So a lot of studies have shown community gardens are very therapeutic, and also it's just a really great way to kind of distract yourself and clear your mind while you're planting. The next program in our program is going to be our backpack program. So students or families would be able to request a backpack each week or monthly, whatever they might need, and it would have access to some non-perishable items as well as some nutritional food items like fresh fruits and vegetables from the garden. This will hopefully improve the mental and physical health of a lot of adolescents and their families. But all of these items, again, are coming from our community garden that students are going to be creating on their own. The non-perishable items will come from the community as well. So our community members that are in our action team will help to donate different items. And also, since I'm in a school district where sports are very supported by the community, as entry for sporting events, we would have food drives, and community members can actually bring non-perishables to enter. So all of these items would be used for our backpack program, as well as our food pantry, which is the next program. So the food pantry would be located within the community, within walking distance of the garden and the school. The food pantry would have access to non-perishable items and nutritional food items for students and their families, or any community member really. It will hopefully improve mental and physical health, and it will also give a possibility for part-time work or extra income for community members that need it. So again, as we know through the literature review, one of the main causes of food insecurity is annual income. So if we are to get some grants that can give us some income, we would be able to actually pay community members to come in and do some organizing or some stocking of shelves. And this would hopefully help them, as well as giving them access to the nutritional food items. So all 4 of these programs are very, very important for the success of the program, as well as some curriculum that we will be implementing. So since this is a school and community project, there are lessons that I've included in my project that kind of span across a couple different content areas. So the first one being health class. So in New York State, students do have to take health. So in health class, they would be learning about food insecurity. I also gave some example lessons that talk about nutrition and healthy eating habits. And they would also be talking about different eating disorders. So all of these things could be spanned across a couple different days, a couple different lessons, but all of them help to talk about food insecurity and how to work on that. The next class is science class. So again, with all of our programs like the composting and the community garden, there's a ton of room for learning there. So some lesson plans I included in my project were an introduction to composting, learning what it is, how to set it up. Again, students would be brainstorming and working together to create a compost. They would learn about plant growth, photosynthesis, the flow of energy, as well as environmental footprint. And lastly would be a foods class or home ec class. Students would learn about the basics of cooking, how to cook, the tools for cooking, basic nutrition, and they'd also actually learn some recipes that they can cook with fresh ingredients. So since we have the community garden, they would be sent home with some fresh ingredients. They would learn how to cook some recipes with them so that they can cook those at home for their families. So as far as assessment, I have some quantitative and qualitative assessing that the Community Care Council will do monthly. So they will be tracking attendance and usage of the backpack program and the food pantry as well as the garden. They will take stock of the food pantry, what items are going, how often items are leaving the shelves. And for students who are taking part in the backpack program, we will be tracking their grades. Now, food insecurity we know has a negative mental and physical effect in adolescence, which means a lot of times their academics will suffer as a result. But if students are taking part in the backpack program and they are having access to these nutritional foods, it's our hope that there would be an increase in their academics as the program continues. As far as qualitative, we will be working directly with students to talk about what is working and isn't working with the backpack program, as well as talking to community members and surveying them on the garden and the food pantry about the items and what is and isn't working for them. So overall, through research, it is proven that students will have more success with their academics when they're fed a nutritious and healthy diet. So the healthy diet we know will improve their mental and physical health, and the Community Care Council is going to ensure that all students' nutritional needs are met through all the programs that they've implemented. Through volunteer work and critical thinking and collaboration, students will work together to help the community and spark this change that we need. And one can anticipate that after implementing the programs, there will be a reduction in homes suffering from food insecurity, as well as a more positive community attitude. And lastly, my references. So I had a really great time doing this project. I feel like I really learned a lot, and it's definitely something that I can implement in my district over the next few years. And I would love to see this in a lot of other low-income districts as well. But I do wish everybody the best of luck in their future endeavors, and I can't wait to read your projects. Thank you.